Hello everyone, we are Helisa, a platform that allows you to easily aggregate, view, and transfer your medical records. Helisa puts your health in your hands, allowing for your records to be your way.
Several years ago, I experienced about a year and a half of complicated medical issues. I went with my family to different hospitals and doctors all across the country, but was constantly frustrated by this process. Each of the organizations that we went to functioned on separate electronic medical record systems, making it impossible for me to send my medical records. Due to this, I had to carry hundreds of pieces of paper, dozens of files, and multiple CDs in order to share my history with my doctors.
Many students, especially college students, face the same problem that Adam faces. It is extremely difficult to both access and transfer your medical records quickly and conveniently. Right now, in order to determine the magnitude of this issue, we want to focus on a segment of the 676,000 students who visit the hospital frequently every year at small colleges. From there, we can expand to a broader market who faces this issue, the 4.6 million college students who visit the hospital at least once a year, and the 17.5 million total students who attend American colleges and universities.
Helisa has created both a mobile application and web platform to facilitate the seamless transfer of medical records. Both doctors and patients are able to upload their medical files. Are able to upload their medical files and then transfer them with our mobile application.
So there you can see the online dashboard where doctors and patients can access the dashboard. So patients can choose which records they want to send to their doctors through the mobile application, and doctors can scan the patient's mobile application to receive records of the patient's choosing. So the core mission of Helisa is to improve the overall quality of healthcare in the United States. One of the main unique values Helisa brings to the table is that we allow patients to control who access their health data and which data is shared to different people. Another benefit of Helisa is that medication, lab results, and allergies are accessible and portable to caregivers. Lastly, Helisa allows an increased speed of the healthcare provided by decreasing repeat testing. So we gained considerable traction over the past 3 weeks by having people test our app and contacting various organizations. Through the 15 people who tested our app, 10 of them were willing to use the app and found value in our product. We also contacted the CMO of Myriad Genetics and the Clinical Systems Coordinator at MIT Medical, and both of them not only provided us valuable advice, but they also saw a great potential and market for our product. In the future, they are willing to provide help and advice to us in scaling our business.
Two key metrics makes Helisa so unique in the market. One being the portability of medical records, and two being the number of services we offer. Apps like MedFusion allow you to view your medical records. However, MedFusion works with only 1 out of 650 different electronic medical record systems, not to mention that the records are non-transferable. Moving on to two bigger competitors, Dr. Chrono and NextGen Patient Portal, they allow you to do more, as you can view recent test results, view your records, and contact doctors. Yet, like MedFusion, the records are non-transferable, and for the apps to even work, they must be compatible with your doctor's electronic medical record system.
Helisa plans to sell its services to small colleges on an annual flat fee based on the organization's size. This block system allows organizations to select the size that works for them and increase and decrease users as needed.
So this is our financial projections for the next 5 years. In year 1, we hope to have around 1,500 users, and in year 5, we hope to have around 130,000 users. And we hope to charge around 40 cents for the cost of goods because we need to keep our servers up. And by the 5th year, we want to have just over $1 million in revenue. And this is Team Helisa. We're a group of 3 young entrepreneurs who have different skill sets and one goal to solve this issue. Hi, my name is Rohan. I'm in charge of marketing and finances, and I'm from California. That's Jenny. She's in charge of operations and management, and she's from New Jersey. And this is Adam, who's in charge of app and web development from Florida.
In the near future, Helisa has 3 main goals for growth. First, we plan on getting further traction by contacting small organizations and universities. Through this, we will acquire beta users who will test and give us feedback on our product, which will allow us to improve and iterate our app. Next, we will use this data we get from traction to convince insurance companies to partner with us. And through this, we will mandate usage of our product to people who purchase their insurance. Lastly, Helisa wants to continue growing with partners and support network for further feedback and advice as we continue to scale in the future.
Thank you all so much for listening, and please remember, Helisa makes your records your way. Please feel free to reach out to us on the following platforms.